aspergilloma. Okay, the third one which you are going to see in severely immunocompromised patient is invasive pulmonary aspergillosis. In that condition, you are going to see vascular invasion, and due to vascular invasion, you are going to see hemoptysis, and you are also it is linked with severe neutropenia. Okay, and you will see whenever you have a immunological condition in which the neutrophils are down, there are high chances of aspergillosis infection. Okay. Okay, let's move on to the next one. Okay, the answer for this question is chronic colonization. Okay, it is an asymptomatic condition found incidentally. Okay, the organism responsible for this patient condition most likely produces which of the following virulence factor. Okay. 3-year-old boy who recently immigrated to the United States emergency department. Emergency department. Okay, this is very important in this question. With fever, malaise, and painful swollen right knee, he is hypotensive, he is tachycardic. Medical history is significant for recent episode of acute otitis media and several vaccinations that are not up to date. Okay, so the patient has also does not taken vaccination as well, and he has a recent episode of acute otitis media as well. Okay, arthrocentesis of the right knee shows cloudy synovial fluid. Their gram stain of the aspirate shows a pleomorphic gram-negative cocobacilli. Okay, it is a pleomorphic gram-negative bacilli. Okay, cultures performed on the blood agar plates supplement C. Now, if you know this specific agar in which we use a NAD and hematin, you will within a second you can diagnose this patient, because this agar is very specific for one specific bacteria. Okay, try to memorize those agars, those staining techniques. Okay, if you just memorize those staining techniques, you can solve this question like in an instant. Your 50% of the questions of the world regarding the microbiology can be solved. Okay. Okay, so we are using hematin and NAD plus agar to grow this specific bacteria. And this specific bacteria is pleomorphic gram-negative cocobacilli, which is due to which the patient is coming to the emergency department. Okay. Okay, first we have to diagnose the patient. What is the specific bacteria which is causing this? Okay, so the patient has septic arthritis, right? That's why the patient's aspirate is right knee shows a cloudy synovial fluid. The patient has septic arthritis, and the cause is a gram-negative cocobacilli. Okay, you have to memorize the logarithms as well. Okay, the logarithm for the gram positive and the gram negative. This is the logarithm for the gram negative. Okay, so this is diplococci, this is cocobacilli, this is curved rods. Okay, and this is bacilli. We know from the question that it is a cocobacilli, right? It is a cocobacilli.
Yes.
So these are the cocobacilli one: Haemophilus influenza, Bordetella pertussis, and Pasteurella brucella. Okay, and he has told that the agar we used contain hematin plus NAD plus. Okay, and the infections are septic arthritis, and the other one is otitis media, right? Okay, let's start with Haemophilus influenza. Okay, what is the agar we used for the chocolate agar we used for Haemophilus influenza? What are the two factors we use for the NAD plus and hematin? See, so the answer in this case is Haemophilus influenza. That is the organism which is causing the infection here. Okay, okay. And what are the infection it causes? Epiglottitis. Remember, epiglottitis is also an emergency condition. If you have to differentiate between epiglottitis and the other infection is a
Group.
then the croup. The croup is not an emergency condition. Epiglottitis is an emergency condition. Is in this condition, the patient's condition deteriorates within 24 hours, and you have to give the treatment within 24 hours. And but when the examiner will give you a condition of croup, the patient's condition develops within 48 hours or 2 to 3 days. That is not a emergency condition. Okay, so that will also help you in differentiating between epiglottitis and the croup. Okay, it can also cause a meningitis, otitis media, and pneumonia as well. Our patient also has a otitis media as well. Okay, usually we use vaccine against the Haemophilus influenza. Okay, non-typable unencapsulated strain are the most common cause of mucosal infection as well invasive infection, since the capsular type B was introduced. Okay, usually in the patient, because we give the vaccination, so the infection Haemophilus influenza have many types. Okay, some types the vaccine we give to the patient usually includes usually are for the capsular type, but in this specific patient, the patient has not taken any vaccination, right? The patient has not taken any vaccination. He is not up to date with the vaccination. Okay, and so that's why the infection in this patient will be due to the typeable one. Okay, due to the typeable one, and the typeable ones are the ones which are encapsulated. Okay, if the person is vaccinated, then the infection will be due to un, unencapsulated strains, okay, which are less lethal. Okay, but our patient is not vaccinated, and due to which this our patient will be getting infection from an encapsulated one. Okay, which are much more lethal. Okay, okay. So in Haemophilus influenza, the encapsulated one, what is the main virulence factor there? The capsule. Okay, the capsule is the main virulence factor there. In our vaccine, which we are giving, which we give for Haemophilus influenza, the main thing which we give in the vaccine is it will contain the capsular polysaccharides. Okay, so our body will remember that this specific part is a part of an infection, and when the body will again see that infection, it will starting to produce antibodies, and it will start to generate a neutrophilic response against that bacteria. Okay, so the main virulence factor in Haemophilus influenza is the capsule. Okay, the capsule is written may exotoxin, endotoxin. Okay, bacteria virulence factors. Capsular, yes.
So basically, there's capsular and encapsular.
Yes, there are two types. One are the capsular one, and the other ones are unencapsulated bacteria. But in usual people, because usually people are vaccinated against the Haemophilus influenza, that's why the infection that people usually get due to Haemophilus influenza are from the unencapsulated type. Okay, which are less lethal. But in our patient, the patient does not get the vaccination, due to which the infection in this case the patient will get is due to the encapsulated ones. Okay, okay. Capsular polysaccharide is the major determinant of the virulence. Okay, how does it enables the bacteria to cause infection? It acts as a barrier of phagocytosis and complement mediated lysis. What type of lysis? Complement mediated lysis. Remember this as well. Okay. Major determinant of virulence is capsular polysaccharide in this patient. Other than that, it also produces IgA protease as well. Okay. 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 So what would be the answer here?
A capsule.
Capsule.
Yes.
A.
Cytotoxin, exotoxin. The exotoxins are produced by what bacteria? What bacteria produces exotoxins?
Gram positive.
Gram positive.
Gram positives like the botulinum, the tetanus, the diphtheria. All of these are due to exotoxin, and endotoxin are due to gram negative.
Medical.
Okay, Fimbri. Fimbri is a virulence factor for which bacteria?
Gram
E.
negative.
coli. E. coli. Okay. Hyaluronidases. Hyaluronidases is produced by which bacteria? It is produced by Staph aureus, Streptococcus pyogenes, and Clostridium perfringens. Okay. Okay. Hemolysins. Hemolysins is produced by what bacteria? It is produced by Staph aureus as well. Okay. Capsule is the main virulence factor in Haemophilus influenza. See, there are two types. One is the unencapsulated bacteria, the other is the encapsulated bacteria. The patient is under vaccinated. That's why the type B strains are the ones which are causing infection in this. And those and type B are involved in much more invasive diseases like septic arthritis, meningitis, and bacteremia. Okay. Which of the following is the main virulence factor? Patient necrotizing infection. Worsening fever, productive cough, shortness of breath. He has no prior medical condition but experienced an influenza-like illness during the past week. Temperature is 38.3, blood pressure is 100 by 50, pulse oximeter is 86%. Leukocyte count is there's crackles over extensive parenchymal consolidation and cavitation as well, suggestive of abscess in the right middle and lower lung. Culture of the tracheal group, gram positive cocci in clusters. Gram positive cocci in clusters. Okay. So what is the diagnosis here? What is happening in this patient?
Pneumonia causing infection.
Pneumonia. The patient has pneumonia. Okay. First, okay. Can you tell me the name of the infections which we get after influenza? After influenza, what are the infections which can cause pneumonia? After the patient has a history of influenza-like illness during the previous week, and after that he got a super infection due to some other bacteria leading to pneumonia. What are the
Nepharius.
Aureus.
other than that? What are the other
Streptococcus pneumonia.
Yes, Streptococcus pneumonia,
influenza.
Staph aureus. Okay, let's first see influenza. There is influenza. Okay. Patient at risk of for fatal bacterial superinfection. Most commonly Staph aureus, Strep pneumo, and Haemophilus influenza. These are the three bacteria which can cause superinfection after the infection of influenza. Okay, our patient has influenza. After that, he develops some kind of super infection, which can be due to either of these: Staph aureus, Strep pneumo, or Haemophilus influenza. Okay. and it is also written in post-viral strep pneumo, staph aureus, Haemophilus influenza. Okay. The culture in this shows gram positive cocci in clusters. Haemophilus influenza is gram negative, right?
Negative.
So
Negative.
Haemophilus influenza is eliminated. We are left with two options: strep pneumo or staph aureus. Both of them are gram positive, right? Okay, which one is in clusters and which one is in chains?
Staph in clusters and streptococcus in chains.
Yes, staph aureus is in cluster. Staph means grape-like. It is in cluster, and strep pneumo is in chains, either in chain or it is a diplococci. Okay. Okay. Streptococcus either pairs or chain. Okay. Staph aureus clusters. So we are sure in this bacteria, the specific bacteria we are talking about in this question is Staph aureus, right? Okay. Now we have to see what is the main cause which is leading to the necrotizing infection here. Okay. M protein. The M protein is involved in which disease? There is a specific cardiac disease name in which there is an antibodies against the M protein.
Group Group A step
Rheumatic fever.
Rheumatic fever that is caused by which bacteria?
Strep.
Step pyogenes.
Group A that is caused by strep
Group A
pyogenes.
is
Group
strep.
A in which we formed antibodies against the M protein, leading to the antibody against the A heart protein, and it causes rheumatic fever. So M protein is not the answer. Okay, polysaccharide capsule. Okay, if polysaccharide capsule is the answer, then strep pneumo also has the polysaccharide capsule, right? Strep pneumo has polysaccharide capsule, and it is the main virulence factor for strep pneumo, right? But strep pneumo never causes a necrotizing lung infection. Okay, we see lobar pneumonia in strep pneumo, right? That is not a necrotizing infection. Okay, in this we are seeing cavities to be developed in this. So polysaccharide capsule is not the answer. Ligosaccharides. Lipo-oligosaccharide is the name for endotoxin.
Remdesivir.
Lipo-oligosaccharide, yeah. And endotoxins are used seen in which bacteria? In gram negative. So the only answer left is leukocidin. Okay. Let's see in Staph aureus. Pentone valentine leukocidin, which kills leukocytes and causes tissue necrosis. Leukocidin is the main virulence factor which differentiates it from the strep pneumo, and that is the reason this is the specific virulence factor which leads to the development of what? The in necrosis here. That is the one which leads to the development of the necrotizing pneumonia here. Okay. It causes inflammatory organ abscesses, pneumonia often after the influenza virulence infection. Okay. Is beta hemolytic catalyze positive? Okay. So leukocidin is the one which is leading to the necrotizing infection here. Okay. Leukocidin, necrotizing pneumonia. You are going to see cavities and abscesses to be developed in Staph aureus. It is very specific for Staph aureus. Okay, you are not going to see the cavitary necrotizing pneumonia in any other infection. Cannot be happening in strep pneumo, in Klebsiella, in Legionella. Okay. Okay, tissue necrosis. Okay, let's move on to the next one. Polysaccharide capsule is also a virulence factor of Staph aureus. Okay, that does not mean that the option number D is not a virulence factor of Staph aureus. In the question, he is asking specifically which virulence factor is causing the necrosis here. is causing the necrotizing infection here. Okay. Staph aureus also has capsule. Okay. But that capsule is not the main cause of causing the infection here. Is not the main cause which is causing the necrosis here. The main virulence factor which is causing the necrosis here is the penton valentine leukocidin. Okay, remember this thing. This doesn't mean that the patient does not have capsule. Okay, the bacteria does not have the capsule here. Staph aureus also has the polysaccharide capsule, but it is not the cause which is leading to the necrotizing infection. If you remove the leukocidin, then the pneumonia which is caused by Staph aureus is the same like the strep pneumo. Okay, that pneumonia will not have necrosis there. Okay, if the cause is only capsule, not the leukocidin. Okay, so let's move on to the next one. This observed growth pattern most strongly correlates with which of the following? Okay, 52-year-old, 3 weeks of cough, night sweats, and hemoptysis, type 2 diabetes mellitus, Vietnam, Southeast Asia. Vietnam 15 years ago to start a job as an associate professor at a university. 20 pack years smoking history, but quit 5 years ago. Sputum culture grows on a selected medium demonstrate mycobacteria that grow in parallel chains forming serpentine cords under microscopy. Okay, that is forming serpentine cords under microscopy. This observed growth pattern most strongly correlates with which of the following bacterial characteristics? The serpentine cord is related to what? Is it related to the acid fastness? Is it related to the antibiotic resistance? Or is it related to pigmentation, replication rate, or is it related to virulence? The diagnosis in our question is tuberculosis, right? And he is asking specifically what is the role of that serpentine cord, which we are seeing in this under microscopy here. Okay. Open the so mycobacteria. Okay, cord factor creates a serpentine cord appearance in virulent mycotuberculosis strains, which is going to activate the macrophages, promoting the granuloma formation and inducing the release of TNF alpha. Okay, so cord factor is related to what? Is it related to
Virulent.
pigmentation or
Virulent.
virulence?
Virulent.
Virulent.
It is related to virulence. Okay, it is related to virulence. Okay, the acid fastness is due to what? Due to the
Mycolic acid.
mycolic acid. Very good. The acid fastness is due to the mycolic acid in the cell wall of this bacteria. Okay, and usually the antibiotic resistance which develops in mycobacterium tuberculosis is due to the mutation in the gene, in the mycolic acid synthesis gene. When there is a mutation in the gene, due to which isoniazid and rifampins are usually does not able to act on that bacteria. Okay.
Yeah, cat G is absent.
Yes, let's see. Cap gene, yeah, very good. Cap gene is going to be absent. Respiratory viral panel results are negative. Infection with which of the following pathogen most likely triggers this patient worsening symptoms? See the option. Okay. Now see, read the whole question. 68-year-old woman comes to the emergency department due to cough and shortness of breath. She has a history of COPD, often coughs up clear sputum in the morning. Over the past 4 days, the cough has worsened significantly, and the patient now is producing thick greenish sputum. She also feels winded when walking short distances or doing light housework. Former smoker with a 40-pack year history. The patient is breathing with pursed lips. Expiration is the expiration phase is prolonged. Vesicular breath sounds with diffuse wheezing. Chest X-ray shows hyperinflated lungs with a flattened diaphragm. There are no alveolar opacities on the pleural effusion. Respiratory viral panels are negative. Viral panels are negative. Infection with which of the following pathogen most likely to trigger the patient's worsening symptom? Okay. Which bacteria can cause the exacerbation of COPD? What is the name of those bacteria?
Staph aureus and Pseudomonas.
H influenza.
H influenza.
Hemophilus influenza or
Yes, Haemophilus
Yes.
influenza. Yes.
COPD, H influenza.
Superimposed infection in the Haemophilus influenza.
Staph aureus also.
okay. Post COPD. Post COPD, you are going to see infection with strep pneumo, Hemophilus influenza, Pseudomonas, Moraxella catarrhalis. These are the 4 bacteria which can cause infection post COPD, which can lead to an exacerbation of COPD. Okay, there are viruses as well involved. The name of the viruses are rhinovirus, influenza, and respiratory syncytial, and the RSV virus. These are the 3 viruses as well. Because 70% of the exacerbations of 70% of the exacerbation of COPD are due to some infection. Okay, and that can be due to virus, and that can be also due to bacteria. In the question, he has clearly mentioned that the respiratory viral panel is negative. Okay, that eliminated rhinovirus, influenza virus, and the RSV virus. Okay, these 3 viruses are eliminated. Now we are left with 4 bacteria. Now you have to tell me which of these bacteria is present. Is strep pneumo, Haemophilus influenza, Pseudomonas, or Moraxella? Which is going to be the right answer here? Is it
Is
going?
gram positive then the streptococcus pneumoniae.
Is Streptococcus pneumonia in the options?
Is H influenza is in the option.
Yes.
So
Yeah. Only.
H influenza.
Yes. There is no Moraxella catarrhalis in the options. There is no strep pneumo in the options. Yeah. The only option, the only bacteria which can see in the options is Haemophilus influenza. Okay. Infections are the most common cause of the exacerbation of COPD. Usually 70% of the times. 30% that can be due to non-infections. In the infection that can be due to viruses as well as bacteria. In viruses, there are 3 viruses: influenza, rhinovirus, and RSV virus. Okay. Which of the following virulence factor most likely contributed to the development of this patient's current condition? 2-day-old boy in the 2-day neonatal intensive care unit for lethargy and respiratory distress. Born at home via spontaneous vaginal delivery at term gestation to a mother who did not receive routine prenatal care. Okay. Who does not develop routine prenatal care. Temperature is 102, pulse is 162. Physical examination tachypnea, quarantine. Beta hemolytic gram-positive cocci in chains that elicit a narrow zone of complete hemolysis on blood agar. Okay. which is going to be the, which of the following virulence factor is going to be the development of this patient's condition? Okay. It is a group A. First,
Group
we
B,
have to, yes,
Streptococcus B.
the patient is developed spontaneous at term gestation. It is a home delivery. And the patient does not receive a routine prenatal care. That is very
Screening,
important
yes.
here. Yeah, because when you in every mother a we give penicillin before the birth if the patient has any risk factor for group B streptococcus. We give a dose of penicillin before the delivery of the baby to every mother who has a risk factor for group B streptococcus. Okay, it is a routine thing. Okay, but in this patient, the patient does not have a routine prenatal care. Okay, that's why he is developing these symptoms. Okay, we know endotoxin cannot be the answer here. Antigenic variation. Antigenic variation is seen in which?
In Nigeria.
Veneria.
In
Nigeria.
Nigeria, and in which virus? In which virus?
Hepatitis C.
And influenza virus as
I mean,
well.
influenza.
Influenza,
It's
yes,
segmental
influenza,
virus.
yeah.
Okay. Exotoxin. Exotoxin usually produced by, it can E. coli, diphtheria, tetanus, but the patient, yeah, but the patient is not showing any signs of those. Okay, and the patient and the bacteria is beta hemolytic gram positive cocci in chains. First, let's see which are the bacteria which are beta hemolytic gram positive cocci. It is subtype of streptococcus, right? And in streptococcus, it is beta hemolytic. Which bacteria are beta hemolytic and streptococcus?
Group
What are the name of
A
those
strep
bacteria?
and B strep.
Yeah, it is either group A or it is either going to be group B. We are limited, so we have only two options. It is either group A and the other one is group B. And out of these two, which one causes most infections in the babies?
It's Agalacti.
Group B.
Galaxy.
Group B.
Group B. The B stands for babies. Okay, that is
Galactic baby.
group B for babies. Okay. Okay. And what is the main virulence factor here of group B? Polysaccharide capsule is the main one which causes the virulence. Okay, it can cause pneumonia, meningitis, sepsis, mainly in babies. Screen patients at 35 to 37 weeks of gestation with the rectal and vaginal swabs, and the patient which are positive receive intrapartum penicillin or ampicillin prophylaxis. But in our patient, the patient does not receive a routine prenatal care. It was the patient was born at home via spontaneous vaginal delivery. Okay, that's why the patient does not receive any intrapartum prophylaxis for group B. Okay, and that's why the patient develops this condition here. And the main virulence factor for group B is polysaccharide capsule. Polysaccharide capsule confers virulence. What is going to be the answer here? Polysaccharide capsule. M protein is the main virulence factor for group A. Right? Group B, vertical transmission, sepsis, sialic acid, nuclear administration. Okay. Which are the, what type of budding it is? What type of budding?
Broad-based.
Yes, it is a
Broad-based.
broad-based. Okay. It is broad-based budding. Okay, and broad-based budding is specific for one bacteria. It is very specific for one fungi. It is very specific for one fungi. Okay, first read the whole question. See the option. Aspergillus. We know that in Aspergillus you are going to see hyphae, right? In Candida you are going to see pseudo hyphae. Okay, Cryptococcus neoformans, Histoplasma, Rhizopus also hyphae. Cryptococcus you are going to see the red one and the India ink halostin. You remember how does the Cryptococcus neoformans looks on the histology slide? It is either the red one, or it has a very thickened capsule. We are left with these three options: histoplasma, blastomyces, and the imitis. Okay. In histoplasma, you have seen that within the macrophages, there are small round dots, circles, large number of small round circles within the macrophages. 48-year-old man, 6-month history of cough and fatigue, malice, weight loss, does not recall any sick contact. Patient is a carpenter, left lower lobe crackles, pulmonary infiltrate in the lower lobe of the left lung. Result from sputum potassium hydroxide per patient shows this. Okay. Okay. If you people remember, how does the histoplasma histoslide looks like? This is the histoplasma slide. Okay. Macrophages filled with histoplasma smaller than RBCs. And this is occlusiomycosis. There you are going to see cephreus. And this is the blastomyces. Okay. And all of the following can cause pneumonia and can disseminate. Okay. All of these causes pneumonia. Okay. All four of them. Okay. And they can also disseminate as well. And our patient is right now suffering from what? Pneumonia. Okay. And so what will be the answer here? The broad-based budding is due to is in which bacteria?
Blastomyces.
Blastomycosis.
Okay. Large yeast with a single broad-based bud. Okay. Is there any location also given here? No location. Okay. Which of the following is the most likely cause of this patient's symptoms? In Mississippi. Where? In Mississippi. Which of these bacteria causes granulomatous disease? Which of the bacteria causes granulomatous disease and is associated with Mississippi? Okay, every systemic mycosis causes granulomatous disease. All four of them can lead to granuloma formation. Okay, and out of all these five options, which one is the one which we studied in the systemic mycosis? Blastomyces.
Blastom.
Okay, because this is the only bacteria in this whole option that causes granulomatous disease. Okay, because the biopsy in this case showed that there's a granulomatous inflammation. Okay, histoplasma, blastomyces, coccidium, all of four can lead to the formation of granuloma. Systemic mycosis can form granulomas like TB. Okay, okay, and the uh, and see the location: Mississippi and Ohio River Valley, Eastern and Central Lakes, Great Lakes, Southwestern US and California, and Latin America. Okay, because most see the location here. Okay, blastomyces. So in this, the only one which can causes the granulomatous disease is the blastomyces. Okay. Okay. In Mississippi, there is also histoplasma. Mostly the infections are due to histoplasma, but that is an area which overlaps between blastomyces and histoplasma. Okay. So again, question regarding the virulence factor. Sudden onset, high fever, shaking chills, shortness of breath, and productive cough. Sudden onset, high fever, high fever. The patient has smoked a cigarette for 48, dullness to percussion on the left side of the chest. Consolidation in the left upper lobe. Gram positive cocci in pairs. Gram positive cocci in pairs. There is a zone of incomplete hemolysis. Okay, first tell me what type of pneumonia it is. What type of pneumonia it is?
Lobar pneumonia.
Pneumonia.
It is lobar pneumonia. It is lobar pneumonia. And what are name of the bacteria? Name the bacteria which causes lobar pneumonia.
Streptococcus pneumonia, Legionella, Klebsiella as well.
Klebsiella. Okay, we know there are three bacteria which causes lobar pneumonia. Typically, organisms are three. Klebsiella is a gram negative, right? The only two positive are Legionella and Strep pneumo. And we know that Legionella usually does not stain with the gram staining. We use some type of silver stain to stain the Legionella. And in Legionella, you will also see diarrhea and some neurological symptoms as well. Okay, so we are left with Strep pneumo. And we know that Strep pneumo is a alpha hemolytic bacteria. These are alpha hemolytic. Alpha hemolytic means that it's going to cause incomplete hemolysis, right? Partial hemolysis alpha. Okay, complete hemolysis beta. No hemolysis gamma. Okay, and in our question there is incomplete hemolysis. There is partial hemolysis. Okay, and partial hemolysis, and it is streptococcus. Okay, so partial hemolysis occur in two types: strep pneumo and viridans streptococci, right? And in between these two, which one causes the lobar pneumonia?
Strep pneumo.
Strep pneumo is the one which causes
SP.
the lobar pneumonia. Okay. Okay, now comes to strep pneumo. Strep pneumo is a diplococci. Strep pneumo is what? Diplococci. And in the question he is mentioned, it is a gram-positive cocci in pairs. In pairs, that means it is a diplococci. And we know strep pneumo is diplococci, which has alpha hemolysis features. And he's the one which causes lobar pneumonia. Okay. Now comes to the virulence factor of strep pneumo. Strep pneumo virulence factor is capsule and IgA protease. Is capsule and no virulence without the capsule. Okay, no virulence without the capsule. Okay, so the main virulence factor here is the capsule. Okay, and the vaccines which we used against, which we developed for the strep pneumo also contains the conjugated proteins of the capsule. Okay, it also contains the capsular proteins or the polysaccharides of the capsule. Okay, so in this way our body develops immunity against that specific bacteria. Okay. Okay, capsule, meningitis, otitis media, pneumonia, and sinusitis are the most common infection caused by the strep pneumo. It is a gram-positive lancet shape. What shape? Lancet shaped. Okay. So what should be the answer here? How does the capsule causes the virulence? We have read this. How does the capsule causes the virulence? Capsular polysaccharide act as a barrier to phagocytosis and complement mediated lysis. Okay, act as a barrier to what? Phagocytosis. Now again, tell me what would be the answer here?
D.
C.
D. Resistance to
D.
phagocytosis. Okay. And complement mediated hemolysis. Okay. So D is going to be the answer. The strep pneumo, lobar pneumonia, polysaccharide capsule prevents it is optician sensitive and bile soluble. Okay. Okay. Vaccine contain no strain. Let's move on to the next one. Which of the following additional characteristics are these bacteria most likely to demonstrate? Okay, 46-year-old man comes to the office due to 3 days of fever, shortness of breath, pleuritic chest pain, and cough with purulent sputum. Okay, the patient has no prior medical conditions and takes no medications. He has smoked a pack of cigarettes daily for 20 years. Temperature is 104. There are crackles at the base of the lung, reveals consolidation at the left lower lobe. The microscopic analysis of sputum shows gram-positive lancet-shaped foci in pairs. What type of pneumonia it is?
Again, it's
Streptococcus
lower.
pneumoniae.
It is lobar pneumonia, and we know
Yeah,
lobar pneumonia is caused by what 3 bacteria?
Strep pneumo,
Klebsiella,
And
Legionella, strep
Legionella.
pneumonia.
Klebsiella.
Yes, strep pneumo, Klebsiella, and Legionella. Okay. Gram-positive lancet-shaped cocci in pair is consistent with which of these 3 bacteria? Which one of these bacteria?
Strep pneumo.
Strep pneumo. Okay. A strep pneumo causes complete hemolysis, incomplete hemolysis, or no hemolysis?
Partial.
Incomplete partial.
Partial
Partial
hemolysis.
hemolysis. Option B is not the answer, right? Okay. Is it optician sensitive, or is it optician resistant?
Optician sensitive.
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 Optician sensitive. Does the does streptococcus contain catalase, or the staphylococcus contain catalase? Which one contains the catalase?
Staph contains catalase.
Staph
Yeah.
contains.
Okay. Is it bile soluble or bile insoluble?
Bile soluble.
Soluble.
Bile soluble. Okay. That's why the answer is going to be D. Okay. It is bile soluble. You have to memorize this whole logarithm. Catalase positive are the staphylococcus. Incomplete and no hemolysis occurs here. Hypertonic saline and PVR status positive are enterococcus. Okay. Hypertonic saline and PVR status positive are enterococcus. And optician resistant are virid and streptococcus. And sensitive are strep pneumo, and bile soluble are strep pneumo. Okay. So the answer is lysis in the presence of bile salts. Okay. Let's come to this question. Can you see this photo? This thing? Yes. Which of the following is the most likely cause of this special condition? These are the options.
D.
Several days of cough, fever. Physics of the right lung shows occasional rares. Lung infiltrate, pilar adenopathy, right sided pleural effusion, lung biopsy, lung tissue found the patient with the following findings. We know aspergillus from hyphae. It is not virus. Rhizopus from hyphae. Sporothorus does not develop like this. Cryptococcus is either red or has a very thickened capsule. Very thick capsule in Cryptococcus. Okay, so it is not Cryptococcus. Left with B, C, and F. Histoplasma, in you are going to see very small circles within the macrophage.
Macrophage.
It is not histoplasma. Okay, so we are left with B and C. Blastomyces appear as broad-based budding,
Broad base.
single
Broad.
broad-based budding. So it is not. So it is not there. The
C.
only option we are left with
Coccidioides.
crocodile. See, cephreole with many small circles. Cephreole will feed within the endospores of Coccidioides, much larger than RBCs. And in this, there is a macrophage nucleus, and then you can see all of this histoplasma. Okay. And Aspergillus develops like this. See, this is Cryptococcus neoformans. See the outside capsule, the whitish area. How thickened is that? Because Cryptococcus has a very thickened capsule. Okay. And
This is
this you can
medium
see the
scale.
outerish whitish membrane is thin, not thick. Right? That's why it is not
Yes.
Cryptococcus. Okay.
Mm-hmm.
Okay, let's come to this question. Please see the options, read the question. System including respiratory pathogen with cystic fibrosis across the age of the patient. Okay, so in the graph, we can clearly see that the specific bacteria is causing much more infection in the older age and less infections in the early age. Okay, so do you know which bacteria in the cystic fibrosis patient causes infection in the later age?
Pseudomonas.
Recurrent pulmonary infections, staph aureus during the infancy and early childhood, and pseudomonas during the adulthood.
Late, yes,
Okay.
after
In
20.
the later stage, the infections in the pulmonary infections we see in staph aureus patients are usually due to pseudomonas. And in early age, the infections are due to staph aureus. Okay, remember this. If you reverse this graph and you are going to see a hump in the early age and then there is a decline, then the organism would be staph aureus. Okay, but right now the organism would be what? It is going to be pseudomonas, or it is going to be pseudomonas. Okay, and pseudomonas is also the one which produces biofilms. Okay, pseudomonas aeruginosa. See this graph. Staph aureus in the early age, pseudomonas in the later age. Remember this. Okay.
So what about Dr. Respiration?
Okay. A 3-year-old boy is brought to the emergency department with breathing difficulty and drooling. 3 year. It comes to where? Emergency department. Emergency department, very important here. Breathing difficulty and drooling that have worsened rapidly over the last 8 hours. Examination shows a toxic appearing patient leaning forward while sitting on the bed. He has stridor. Stridor is going to seen in which diseases? Inspiratory stridor. Name 2 diseases in which you are going to hear stridor.
Croup and epiglottitis.
Epiglottis.
Yes.
Epiglottitis.
And
Epiglottitis.
group.
Croup. Yes.
Respiratory syncytia.
They are pooled oral secretion and the patient is unable to swallow. Which of the following is the greatest risk factor for this patient condition? Okay. Is it in croup and in epiglottitis, which one is an emergency condition?
Epiglottitis.
Epiglottitis.
Bacterial high
Epiglottitis
grade
is an
fever, drooling, or the picture is with epiglottitis.
okay. If I say the answer is foreign body aspiration, If I say the patient has foreign body aspiration, then what clue or hint is in this question that is telling us that it is not foreign body aspiration?
Fever.
This
First,
drooling,
Fever.
drooling,
Fever.
fever.
Fever, yes. Because you are not going to see fever in a foreign body aspiration case, right? Okay. Eh, okay, second-hand smoke exposure is an international travel. Okay. So we are sure that. Can you tell me the specific name of the position that the patient has taken in this, in which the patient is like
Tripod.
nodding forward,
Tripod
position.
tripod position. Very good. This position is called tripod position, and tripod position is very specific for epiglottitis. Most the cause of epiglottitis is which
H
bacteria
influenza.
causes the
H influenza.
epiglottitis?
H influenza.
Influence.
H influenza, and invasive infections of H influenza are due to what?
Because of incomplete vaccination.
Incomplete vaccination. Like if the patient have vaccination, then he will never get an infection due to it. Then he will never develop invasive infections of Haemophilus influenza. Like in the previous case, we have also seen septic arthritis case, right? That patient also does not have the vaccinations. That's why he develop an invasive infection of Haemophilus influenza. Okay, if the patient has vaccination, then he will never develop Haemophilus influenza invasive infections. Okay, let's see. Fever with dysphagia. Our patient has dysphagia, right? Inability to swallow. The patient has drooling, right? The patient has inspiratory stridor, right? There is a difficulty in breathing due to edema, right? All of these things are present, right? Haemophilus influenza type B also capable of causing epiglottitis in fully immunized children as well. Okay, epiglottitis is most commonly caused by Haemophilus influenza type B, and that position that patient takes place is the tripod position. Okay, it is also written here. Haemophilus influenza. Causes epiglottitis. Appearance can be in cherry red thumb skin. Okay, see, this is kind of thumb sign. The epiglottis becomes due to edema. The epiglottis becomes thickened. Okay, and due to that, because epiglottis covers the opening of the trachea, right? Eh, because it covers the opening, when it becomes thickened, you are going to see the obstruction. Okay, okay. This is called the thumb sign, which you are going to see on the lateral chest X-ray. Okay, this seen in epiglottitis. Okay, let's see. Okay, let's move on to the vaccination series. Drooling, high sign, rapidly progressive, dysphagia, stridor, tripod positioning. This is called the tripod positioning. Trunk leaning forward, thumb open, mouth open, neck and chin extended. Neck and chin extended. Okay, in this way we will be able to keep its trachea open. That's why he will extend its neck. Okay. Hemophilus individual are at greater risk of developing epiglottitis. Which of the following have been helpful in preventing this patient lung infection? Okay, 70 to 80-year-old man, emergency department, fever, cough, shortness of breath, assisted living, 40-pack air smoking history, blood pressure 106/62, dullness to percussion, bronchial over the left lung, left lower lobe consolidation. That means the pneumonia type is lobar, left lower lobe consolidation. Gram positive diplococci. Which bacteria that is caused the left lower lobe, which causes the lobar pneumonia? What is the name of that bacteria? Which is gram positive?
Strep pneumonia.
Strep
It is
Pneumonia.
yes.
Number
It
one
is
cause.
yes. Strep
SP.
pneumonia.
Strep.
Okay, it is strep pneumonia. Okay. How can we prevent this patient lung infection? How can we? Our patient is not suffering from hypersensitivity pneumonitis, right? Then option number A cannot be the answer, right? Because the diagnosis is not hypersensitivity pneumonitis. Okay, immediate chemoprophylaxis after exposure with inactivated periodic culture and disinfection. Option number D. Option number D will be the right answer for what bacteria? Option number D.
Legionella.
Legionella?
Yes, it will be a right answer for Legionella, because Legionella spread through what? Through the water contaminated
Water
Water.
supply, yeah.
Water.
Okay.
And
Okay.
AC.
Okay. Okay. Option number C will be the right answer for influenza. Option number C.
Yes, influenza.
What will be the answer in this question?
E.
I think this should be E.
Yeah.
We
Option right answer
vaccination.
is
Vaccination.
bacterial polysaccharide. Pneumococcal vaccines are available in both conjugate and polysaccharide formulations. Okay, we use the polysaccharide within the capsule to develop the immunity in the patient. Okay, in the people. Okay, is a polysaccharide formulation. Okay, pneumococcal vaccines. Okay, E will be the right answer. Conjugate vaccines and polysaccharide. These are the conjugate. Polysaccharide. Okay. High fever, confusion, headache, watery diarrhea, cough. Smotopus daily and other history fever is very high. Sputum staining reveals numerous neutrophils, but no bacteria. But no bacteria.
Legionella, maybe.
Legionella, there is diarrhea, typical picture of Legionella.
Okay.
Yeah,
First,
confusion
okay.
because of hyponatremia.
Yes.
Yes. Okay. We know that option number A, we will not see numerous neutrophils. The main one which work against the fungi infection are the lymphocytes, right?
Yes.
So
Correct.
yes, okay. And Klebsiella is going to be seen on gram stain, right? In the question, he has mentioned that gram staining reveals no bacteria, right? It only reveals numerous neutrophils. And if it is Klebsiella, we are going to see Klebsiella on gram staining. But in the question, he has mentioned the bacteria is not visible on gram staining. So Klebsiella is not the answer. Mycobacteria, the main WBCs that work against mycobacterium are lymphocytes, right? Lymphocytes and macrophages, and not the neutrophils, right? So mycobacterium is also not the answer. Left with C and E. Mycoplasma is also not visible on gram staining. Okay, so it is either C and E. What type of pneumonia that does mycoplasma cause? What type of pneumonia?
Bronchopneumonia.
Atypical.
Walking
Atypical
pneumonia.
pneumonia.
Atypical.
Pneumonia.
Atypical interstitial pneumonia.
Oh,
And in
pneumonia.
interstitial pneumonia, what is the temperature? What is the temperature in interstitial pneumonia?
Low grade.
No
Low
temperature.
grade.
Time on 30, you'd like
Low grade. What is the
0.5,
temperature here?
40.
What is the temperature here?
Very high, very high.
Very high.
Fever.
Okay. It is a very high fever. That's why it is not. It can also. It cannot also be mycoplasma. Okay. So the only option left is Legionella, and we know that in Legionella we are going to see watery diarrhea as well. We are also going to see neurological symptoms as well. We are also going to see pneumonia symptoms as well, right? And all of these things can be explained by Legionella. Legionella also does not stain on gram staining, and we have to use special stain, silver stain for Legionella, right? Legionella, stereomonocytosis, Legionella. Gram negative rod, grow gram stains poorly. Use silver stain, okay, or charcoal yeast extract medium with iron and cysteine. And you are going to see hyponatremia. Why hyponatremia? Because of the diarrhea.
Watery
Okay,
diarrhea.
or because of the diarrhea. And you detect it by what? How do you detect Legionella? By the presence of antigens in the urine, not in the blood. Remember this. By the presence of antigen in the urine. Okay, that's the diagnostic test for Legionella. Okay. Severe pneumonia, fever, GI and CNS symptoms. Okay. GI and GI diarrhea, CNS symptom confusion in this patient. Okay. And the mycoplasma pneumonia causes what? Interstitial pneumonia. Mycoplasma pneumonia causes interstitial atypical pneumonia. Okay. In which you are going to see a bilateral multifocal opacities and a much more indolent course, walking pneumonia. The patient will have a low grade fever. Okay. Hyponatremia, urine antigen test. Okay. Let's move on to the next one. Okay, 18 months old boy brought to the physician by his parents for fever, runny nose, sore throat. Fever, runny nose, sore throat. The physician reassures the parent and recommends sportive care with plenty of fluids. He sends them home. He sends them home with instructions to follow up if the boy develops symptoms worsen. 2 days later, the infant is brought to the emergency department with with persistent fever, brassy cough, and difficulty. Physical examination reveals stridor. Okay. Stridor is here in you name the two diseases in which you are going to hear stridor.
Group,
Group and
and
the
epiglottitis.
other one is
Epiglottitis, yeah.
okay. Epiglottitis is caused by the bacteria, and he is asking only about regarding the virus one, right? Rhinovirus, paramoxyvirus, togavirus, parvovirus, and calcivirus. And croup is caused by what? Bacteria. By virus. Okay. And you can clearly see the history. The patient first develops fever, runny nose, and sore throat, and 2 days later he develops the stridor and persistent fever and brassy cough and difficulty breathing. 2 days later, okay, not immediately. To say The virus which is involved in, also called croup, caused by what bacteria? Para-influenza viruses. Results in a seal-like barking cough and inspiratory stridor. Where is the obstruction is narrowing at the upper trachea subglottis. What area? Subglottis area. At the upper trachea subglottic area leads to the characteristic steeple sign. This is a steeple sign. See the steeple sign?
Yes.
Okay.
Yes.
Okay. The virus are the paramoxy virus, right? The other name for is acute laryngotracheobronchitis. Okay, acute laryngotracheobronchitis. Okay. Paramoxy virus includes parainfluenza viruses. Paramoxy viruses causes disease in children. They include parainfluenza viruses. The parainfluenza virus group measles, mumps, RSV, and human metapneumoviruses. So what will be the answer here? Paramoxyviruses, because the para-influenza virus is a type of paramoxyviruses. Okay. Okay. It is not rhino, toga, parvo, paramoxyvirus. Okay. Croup, diphtheria, epiglottitis, upper respiratory tract symptoms, followed by hoarseness, barking cough, stridor, and respiratory distress. Okay. Okay. Which of the following best characterize the organism which is responsible for this? Let's see. Okay. The patient received a lung transplant for idiopathic pulmonary fibrosis 4 months ago. Lung transplant 4 months ago. The patient is on immunosuppressants. The patient is on immunosuppressants. Chest X-ray reveals diffuse interstitial infiltrates bilaterally. Bilaterally. Okay. A decrease in pulmonary function testing, a lung biopsy is performed. Which one is going to be the right answer? Filamentous gram-positive rods, trophic and cystic fungal viruses, invalid double-stranded RNA viruses. Okay. Filamentous gram-positive rods are what? Filamentous gram-positive rods. Can you name them? Can you tell me the names? The only bacteria which are filamentous are the. Yeah, very good. They are
Tino and
actinomyces and nocardia. Yeah, these are actinomyces and nocardia. Okay, but both of them usually actinomyces, nocardia is acid fast, and actinomyces, and in the photo you can clearly see there are no filaments here, right? There are no filaments here. It is not some filamentous bacteria. Okay, there you are not seeing any hyphae-like structures here. Okay. Okay. So I have to show you the photo. Do you know the most common infection which can be occur due to after the transplant? Most common infection is cytomegalovirus.
Cytomegalovirus, yeah.
It is the most common. Even when a patient comes to you with a lung with any transplant, we started the prophylaxis of cytomegalovirus. Okay. Even if the person does not have an infection of say, cytomegalovirus, we still started the prophylaxis for cytomegalovirus because it is the most common post-transplant infection. Most common post-transplant infection. And in the photo, you can also clearly see. Is the photo similar to this? The photo is similar to this? The
Yes.
H1.
Mm.
You can clearly
Yeah.
see this.
Yeah.
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 The oval eyes.
Mm. Oh, I.
The oval eyes. Okay. The cytomegalovirus, especially pneumonia in transplant patients, especially pneumonia in transplant patient. Our patient has pneumonia and it is a transplant patient. It causes mononucleosis in immunocompetent and infection in immunocompromised. Our patient is an immunocompromised. Infected cells have a characteristic oval eye intranuclear inclusion. Okay, and an oval eye intranuclear inclusion. This is the oval eye intranuclear inclusion. Within the nucleus, there is a dark green is circle. Within the nucleus, this is called oval eye intranuclear inclusion. And CMV virus, uh, say cytomegalovirus is a type of herpes virus, and every herpes virus is a enveloped double-stranded linear virus. Okay, enveloped double-stranded. So the right answer would be in this case is
A.
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 Enveloped double-stranded. Right. Oval eye inclusion, say to is particular person with lung transplant. Most but not all transplant centers practice universal prophylaxis for lung transplant patients. There is a question in step 2 where they ask which prophylaxis we give in lung transplant patient, and the answer is Valgen encyclopedia for CMV. Okay, let's move on to the next one. A 15-year-old boy is evaluated for fever, headache, malaise, cough 3 weeks after returning from summer camp. Okay, he returned from a summer camp. Okay, the patient blood samples are collected for an which are test for bacteria. When taken out, submerged in the ice. Submerged ice. Okay, warming the tube temperature leads to rapid dissolution of the clumps. These are headache, malaise, and cough, fever 3 weeks after returning from summer camp with nodular infiltrates. What type of pneumonia it is? Nodular infiltrates. Is it interstitial pneumonia, lobar pneumonia?
Interstitial pneumonia.
Interstitial.
It is interstitial pneumonia, right? Okay. In interstitial pneumonia, okay, first see the organism which causes interstitial pneumonia. Let's see which bacteria causes interstitial pneumonia. Chest X-ray shows bilateral multifocal opacities. Our patient has nodular opacities, right? Okay, which is going to be seen in interstitial pneumonia. Okay. Okay, and the most common causes are mycoplasma, chlamydia, legionella, coxiella. Okay, and viruses as well, RSV, CMV, and influenza and adenoviruses. Which of these also form cold agglutinins, and it is most common in during summer camps, in military camps, and in dorms. Which one of these?
Mycoplasma.
Plasma.
It's Michael.
Mycoplasma pneumonia is most
Mycoplasma.
yes.
Mhm.
Mycoplasma pneumonia is most common in summer camps, military camps, in dorms, in overcrowded areas. Okay, and mycoplasma also produces cold agglutinins. Okay, that's why we are seeing when we are transferring the bacteria in within the ice, we are seeing clumping, and when they are heated again, the clumps dissolve. This is a specific feature of mycoplasma pneumonia. Causes atypical walking pneumonia, patchy or diffuse interstitial pneumonia. Outbreaks common in military recruits, prisons, and colleges. Okay, our patient goes to a summer camp. Occurs in adults less than 30 years of age. Our patient age is 15. Okay, high titers of cold agglutinins, IgM, which can agglutinate the RBCs. Okay, remember it also does not stain on gram stain because it does not have a cell wall. Okay, chest X-ray appears more severe than the presentation. Okay, so what will be the answer here? The only bacteria which causes the interstitial pneumonia is here are Mycobacterium does not.
H. Mycoplasma pneumonia.
Coxella can cause interstitial, Klebsiella. These are the three which can cause. But we know cold agglutinins are the only ones which are produced by Mycoplasma. Okay, antigen cold in below code hemolytic anemia. Okay. The patient's history is most likely to reveal which of the following. "45-year age, severe headache, myalgia, pleuritic chest pain." The patient fails to respond to empiric antibacterial antibiotic therapy. What does that line means? That the
That means
cause
not bacterial.
It's
Yes.
that
not
Resistance.
yeah, the cause is
Resistance.
not bacteria, right?
Yeah.
Microexamination of lung tissue shows spherules filled with endospores.
This is
Spherules,
coccidomycosis.
yeah, this is coxomycosis. Okay, and long history of asthma. A long history of asthma will be the right answer for what diagnosis? Long history of asthma. Allergic bronchopulmonary aspergillosis. Previous cavitary tuberculosis. That would be the right answer for what diagnosis?
Aspergilloma.
Exposure to pigeon droppings.
Cryptococcus.
Fungal
Histo.
neoforming.
Histo.
Okay. Okay. Cave exploration in Ohio. Cave exploration in Ohio.
Histoplasma.
Histoplasma.
Okay, we are
Histoplasma.
left with two options, A and E. Okay, so which one will be the right answer? Which one is going to be for
It is A.
Coccidioides?
A.
Recent travel to
Resistant of
Arizona.
Arizona.
Travel to Arizona.
A.
Okay, yes, A is going to be the right answer. Okay,
Why A?
because recent travel to
Because
Arizona. Let you
E
know,
cannot be.
because coccidomycosis, because in the question he has clearly tells us that there are spherules which are filled with endospores, okay, which is most consistent with coccidioides. Okay, that's why the answer is coccidomycosis, and we know coccidomycosis is an endemic infection which is most common where in southwestern US and California. Okay, cave exploration is happening in women in histoplasma. Cave exploration, okay, which is common in Ohio and Mississippi River valleys histoplasma. Okay. So the answer is southwestern US and California area. And, yes, and the southwestern US includes Arizona, right? Southwestern US includes Arizona.
Yes.
So that's why the answer is A. Okay. He has tell us that there is a lung tissue filled with cephrules packed with endospores, and the infection is not due to any bacteria, because when we gave the patient empiric antibacterial medication, that the patient's condition does not improve. Okay. Okay, let's move on to the last one. Which of the following is the most likely? 46-year-old man intoxicated in the park, fever, night sweat, productive cough with foul-smelling sputum. Foul-smelling sputum. 1 to 2 pints of vodka, hospitalized multiple times for intoxication. Lung disease crackles over the right lower lobe. Right lower lobe. Elevated leukocyte count. Cavitary lesion with air fluid levels. Air fluid levels in the superior segment of the right lower lobe of the lung. In which disease you are going to see air fluid levels? Foul-smelling sputum in lung abscess.
Lung abscess.
What is the cause of lung abscess here? Cause.
Mixed
Klebsiella,
bacteria.
aspiration.
The aspiration.
Aspiration.
Why does patient aspirate in this case?
Because he's alcoholic,
Alcoholic.
encouraged patient,
Alcoholic and
unconscious
intoxicated,
patient,
due to which he aspirate.
And
The
the foul
foul
smell.
smell.
And homeless.
Foul smells.
Yes. Yes. The foul smell is due to what type of bacteria? The foul smell.
anaerobe.
Anaerobes. Due to anaerobes. Okay. Okay. So you have to tell me. Okay. Is it aspiration pneumonia or is it aspiration pneumonitis?
It's
Is
pneumonia.
it?
There is
It is
Pneumonia,
pneumonia,
lower
not
lobe.
pneumonitis.
Lobar
The
pneumonia.
cause of aspiration pneumonitis is aspiration of gastric acid.
acid.
You are only going to see a inflammation of the lung tissue, but you will not going to see any infection there. Okay, if it is aspiration pneumonitis, okay, you are not going to see infection there. And in our patient, there are air fluid levels, and all of these are signs of an infection there. Okay, we are known that it is due to aspiration. C is not the answer. It is not aspergilloma. It is in aspergilloma. You are going to see a fungus ball going to be seen there, not the air fluid levels. It is not a primary mycobacterial infection. Can also does not explain air fluid levels. The only answer that is making sense here is aspiration of oropharyngeal bacteria. Okay. Lung abscess, air fluid levels seen on chest X-ray, alcohol overuse caused by the aspiration of the oropharyngeal contents. Okay, due to anaerobes or staph aureus, presence suggests cavitation. Okay, lung abscess is most found in the right lung, right lower lobe if upright, or right upper lobe or middle lobe if recumbent. Okay, all of these can be explained by aspiration pneumonia. Okay, let's move on to the next one. Which of the following is most likely responsible for this patient's symptom? See the options. Okay, now let's see the question. The patient is of HIV. Fever, chills, productive cough, left-sided chest pain that worsens with deep breathing. His symptom becomes the Buddha was diagnosed with HIV 4 years during, and his CD4 count was 480. Okay, temperature is 38.8, respiration at 28, dullness to percussion and right chosen elevated, dullness to percussion, bronchial breath sound and crackles over the left lower lung. Type of pneumonia here. What type of pneumonia it is?
Lobar pneumonia.
Low bar pneumonia.
Low bar.
Okay, patient has low bar pneumonia. Okay, that's why it's dullness to percussion, bronchial breath sounds and crackles over the left lower lung. Okay, only one lobe is affected, not the whole lung is affected. Okay, and the temperature is 102. That is also a sign that it is not walking pneumonia. Walking pneumonia has low grade fever. It is not low grade. Okay, the right lung and cardiac laboratory testing reveals an elevated leukocyte count with left shift. Left shift. Okay, so we know there are three main bacteria which are involved in lobar pneumonia. What are the name of those three bacteria? Klebsiella,
Strep pneumonia,
Legionella,
Klebsiella, and
and
Legionella.
Strep pneumonia. Yes. So A is eliminated, B is eliminated, D is eliminated, E is eliminated, F is eliminated. Left with two options, C and G. And we know when Legionella causes infection, we are going to see hyponatremia, watery diarrhea, confusion, and all the other symptoms as well. But our
Fever.
patient is only showing the symptoms of pneumonia on, okay, which is much more consistent with strep pneumo, right?
pneumonia.
Okay, strep pneumo is the answer. Lobar consolidation, immunity acquired pneumonia, HIV. Okay. So remember, even in the HIV patients, the most common cause of the most common cause of the pneumonia is strep pneumo, even in the HIV patients. Okay, many people go with the answer of pneumocystis jirovecii. Okay, that is that do causes the pneumonia symptoms in the HIV patient, but the HIV CD4 count in that patient is
Less
480.
than 100.
Okay, for pneumocystis jirovecii, it should be less than 100. Okay, and in that patient it is 480. CD4 count was 480. Okay, that is another reason why F is not the right answer. Okay, and the patient is showing signs of a lobar pneumonia, not interstitial pneumonia. Okay, pneumocystis jirovecii pneumonia is not lobar pneumonia. Okay. The microorganism responsible for patient's pulmonary infection most frequently cause which of the following? Okay.
Crypto.
This kind of staining is used in what bacteria, in what fungi? Muciceramine staining is used in what fungi?
Krypton neoformans.
Cryptococcus
Cryptococcus
neoformans.
neoformans.
Yes, and we also know that Cryptococcus neoformans have thick capsule, and we also know Cryptococcus neoformans causes infection in immunocompromised patient, and when the CD4 count develops less than 100. Okay, now
100.
what type of infections does Cryptococcus can cause? Name, tell me all the infections.
Meningoencephalitis and pneumonia.
Meningitis.
And lung diseases too.
Pneumonia and meningitis.
Hepatitis.
Yes, pneumonia, meningitis, encephalitis. And the CD4 count should be less than
Less than
100.
100.
Okay, less than 100. It causes meningitis, encapsulated yeast on Indian stream. So the answer here would be what?
C.
It is going to be meningoencephalitis.
Meningoencephalitis.
Oral plaques are caused by what?
Candida.
Oral
Candida.
Candida.
esophagitis.
CM.
Also,
Can
this
be
candidate
caused by Candida.
thrush.
Candida.
Candida and there's
To the
one more
hyphae.
white. There's one more white.
Herpes.
CMV.
or HSV.
CMV.
Yes, CMV, yeah.
Okay. Okay.
Yes, CMP.
Sinusitis. Sinusitis.
The mouse was strep pneumonia also.
Strep
Mouse.
pneumonia.
SP.
Mucormycosis and Aspergillus fumigatus. Okay. Let's move on to the next one. Indian stream. This is the Indian stream. Which of the following organism is most likely cause of this outbreak? Investigating outbreak, respiratory infections among the group of military recruits. Military recruits. Reports reports about resistant cough. Grade fever, melts, chest pulmonary infiltrates that appear more severe than what would have been expected.
In that one. Yeah.
And the causative organism requires a complex acellular medium.
Yeah.
Please, can you please mute your mic? We are not hearing what the doctor is teaching.
Okay, I am muted, but okay. So, chest X-ray reveals pulmonary inflammation. What type of pneumonia it is? What type of pneumonia it is?
Interstitial pneumonia, otherwise walking
Interstitial
pneumonia.
pneumonia. The patient has persistent cough, low-grade fever, and malaise, and it is common in military recruits. Okay, and the chest X-ray is more severe than the presentation, and the patient requires the sputum requires a specialized growth medium, which will be enriched with cholesterol. All of these four things are consistent with what bacteria?
Mycoplasma.
Mycoplasma pneumonia. Okay.
Mycoplasma pneumonia.
Yes. In Mycoplasma pneumonia, there is atypical walking pneumonia, outbreaks in the military recruits. Okay. Membrane growth bacteria, bacterial medium contains sterols for stability. Growth on eoton agar, which has a large concentration of cholesterol. Okay. Chest X-ray appears more severe than the patient presentation. Okay, all the four things which are mentioned in the question can be explained by the Mycoplasma pneumonia. And eotin agar is also explained somewhere. See, Mycoplasma pneumonia, eotin agar requires what? Cholesterol. Okay. Okay. So in our patient, all the four things are consistent with Mycoplasma pneumonia. Okay. Walking pneumonia, worse cholesterol. Okay, let's move on to the next one. Okay. Fail to decolorize with hydrochloric acid. 32-year-old. Failed to decolorize with hydrochloric acid and alcohol after staining with carbol fuchsin. Do you know in which type of staining technique we use carbol fuchsin? In which staining technique we use that? Do you know this?
Acid fast.
Acid fast staining. In acid fast staining, we use this type of, see the xyl niacin stain, carbol fuchsin used in acid fast bacteria. Okay, the stains, and this is used to stain what? The mycolic acid in the cell wall. Okay, so in the question, the technique which is mentioned in the question is for the acid fast staining, and the carbol fuchsin stain what? Mycolic acid. It stains mycolic acid in the cell wall that leads to the acid fastness. Okay, carbol fuchsin. Okay. Okay, so what would be the right answer here?
D.
D.
D. Mycolic acid. Okay. Okay, N-acetylmuramic acid and glucosamine are usually used in bacterial cell walls present in both gram-positive. Teichoic acid is also in the peptoglycans, is also cell wall. Cell wall, this is in capsule. Ergosterol is a part of fungi
Single.
cell wall, fungal cell wall. Okay, mycolic acid is the answer. Okay, let's move on to the next one. Which of the following bacteria is most likely to be resistant to this drug? Okay. See the options. Let's see. Okay, glycosyl transferase enzyme is used where? We are using an antibiotic which inhibits the glycosyl transferase enzyme. Do you know what is the role of glycosyl transferase?
No, remind us.
No.
So it is used in the formation of peptidoglycan cell wall. Okay, it is involved in the formation of cell wall. It is the main one which helps in the formation of N-acetylglucosamine and N-acetylmuramic acid. So if you inhibit this enzyme, the bacteria will no longer be able to form its cell wall. Okay, but you have to tell me, out of all these bacteria, which bacteria does not have cell wall? Which bacteria does not have cell wall?
Mycoplasma.
Mycoplasma.
I
Yes.
think so, yeah.
Yeah,
Mycoplasma.
mycoplasma does not have cell wall. That is also the reason why mycoplasma does not stain on the gram stain. Okay, mycoplasma is the one which does not stain on the gram stain. So that's why if you're using an antibiotic which is going to inhibit the formation of cell wall, that antibiotic will not function on the a, a mycoplasma. Okay. Capsule cell envelope photos. See if the enzyme name is written here. Enzyme name is not written here. Because cholesterol. Is a mycoplasma. Mycoplasma. Here it is. Pleomorphic bacterial membrane contains sterol for stability. It does not contain cell wall. Okay. Mycoplasma has no cell wall. Okay. That's why if you are using an antibiotic which is inhibiting the formation of cell wall, that antibiotic will not have any effect on a mycoplasma. Okay.
What page number is that? I'm so sorry.
That page number is
148.
148.
Mm,
Okay.
Okay, thank you. Yeah.
Mycoplasma does not have any cell wall. Okay. Which of the following is the most likely source of outbreak? Long-term care facility develop febrile in a short period of time, fever, non-productive cough, myalgia, rigorous dyspnea, diarrhea. Fever, cough, myalgia, rigorous dyspnea, diarrhea. Stains poorly with gram stain but are visualized using silver stain. Urine antigen testing. Urine antigen testing is positive. Okay. What bacteria we are talking about here?
Legionella.
Legionella. Silver staining is used in which bacteria? Legionella, which does not stain with gram stain. Okay. And urine antigen testing test is used for what? Legionella. Okay. And Legionella also causes pneumonia plus diarrhea. The patient has fever, non-productive cough. That means the pneumonia and diarrhea as well. Okay. So
Confusion
all
too.
the four findings.
Alter metastatus. Yeah, confusion.
Yeah. Okay, all the four findings can be explained by Legionella. Okay, and the source of Legionella is, how does Legionella usually spread?
Nature via
Outbreak.
conditioning.
Water outbreak. Mm.
Yes, water sources. Gram stains poorly uses silver stain. What stain? Silver stain. Detected by the presence of antigen where? In the urine. Okay, lab may show hyponatremia, aerosol transmission from environmental water sources. Okay, associated with cruise ships and nursing homes. Okay, severe pneumonia, fever, and GI and CNS symptoms. Okay, so what will be the answer here?
B. Should be B.
B should be.
Will be
B.
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 Building water distribution system. Okay, 32-year-old man presents with low-grade fever, cough, generalized malaise, has otherwise been healthy and has no significant medical history. His past surgical history includes tonsillectomy, and tympanostomy tube placed at the age of 8. The patient really comes back from outdoor adventure. Outdoor adventure, fever, cough, generalized malaise, Great Lakes, KOH, potassium hydroxide per preparation, which is used for what? For fungal infections. Okay. The wheels are large yeast cell with a single bud. When incubated on a specific material on 24-degree, a multicellular structure with branching tubular cell grows. Dimorphic features. Okay. Dimorphic features. So Great Lakes, outdoor adventure, fever, cough, generalized malaise. Can you think of anything which can connect all these four things? Pneumonia symptoms, outdoor adventure, Great Lakes, dimorphic features.
It's
Like the
blastomycosis.
it is histoplasma capsule.
Blastomycosis.
Yes, sorry, blastomyces. Okay, because a blastomyces has a every systemic mycosis has dimorphic features. Okay, every systemic mycosis.
Mm.
All are caused by dimorphic fungi. Cold, 20 degrees centigrade, mold, single yeast. And on heat, yeast, and on cold, they are mold. Okay. A large yeast cell with a single bud, when incubated in at 24 degrees centigrade at cold temperature, it forms a mold, a branching tubular cell. Okay, it forms a mold. So we are sure that it is some type of systemic mycosis bacteria, a systemic mycosis bacteria. Okay, and we know what are the names of the systemic. There is histoplasma, there is there is blastomyces, there is coquidomycosis. Okay, so this cannot be the answer. 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 And Great Lakes, blastomycosis is associated with Great Lakes. Okay, it is associated with Great Lakes. Okay, outdoor adventure, Great Lakes. So the right answer will be blastomyces. Okay, blastomyces is going to the right answer. Let's move on to the next one. Five-year boy, emergency department. Here, emergency department. Severe respiratory distress. Not received immunization. Not received immunizations. Okay. Very uncomfortable and anxious. Leaning forward, making a loud hard sound with inspiration. Leaning forward, hard sound, most likely stridor. Okay. Temperature, high temperature, 103. Epiglottis is visualized, appears markedly swollen and erythematous. What is the diagnosis here?
Epiglottitis. Epiglottitis.
Yes, epiglottitis is the diagnosis here. Why the patient is leaning forward? This position is called tripod position. A loud hard sound is stridor, inspiratory stridor. Okay, and then the patient say epiglottis is swollen, and the patient does not receive immunization. That's why the patient develops the infection is due to Haemophilus influenza. Okay, okay. Which of the following major virulence factor of the patient is causing the infection here? What is the main risk virulence factor of Haemophilus influenza?
The capsule.
The vaccine which we used for the vaccines which we use for the Haemophilus influenza contain what?
inositol-phosphate.
Polyribositol phosphate capsule. Okay, that is the capsule. It is a constituent of the capsule. Okay, M protein is involved in which? It is group A
Group A.
step. Okay, tree hallose is involved in which? In fungal infections. Okay, and let's open Haemophilus influenza. Okay, it causes the cherry red causes epiglottitis, appearance of cherry red skin, cherry red in children. Vaccines contain what? Type B capsular polysaccharide. And what is the name of that capsular polysaccharide? Polyribosyl ribitol phosphate.
Phosphate.
Okay. So what is going to be the answer here? C, the capsular
C.
polysaccharide. Okay. Okay. Stridor capsule, factor H. Okay. Let's move on to the next one. Okay. Very clear picture. Very clear picture. Okay. Which of the following is the most likely cause? Read the options. 54 years with HIV, non-productive cough, low-grade fever, worsening fatigue over the past month, lost 3.6 kg, does not take antiretroviral therapy consistently, has not followed up with his primary care physician, hepatosplenomegaly, pancytopenia, elevated liver aminotransferases, and on bone marrow. Okay, can you tell me in this picture is consistent with which of the infection?
Histoplasma.
Histoplasmosis.
Histoplasma. Okay, and histoplasmosis can also explain the hepatosplenomegaly, the pancytopenia, and the elevated liver transferases. All of these can be explained by histoplasmosis. Histoplasmosis, Mississippi, and this is a photo. Histoplasmosis. It causes pancytopenia, splenomegaly as well, which we are seeing in this patient. The patient has pancytopenia. There is hepatosplenomegaly that is can also be explained by histoplasmosis. And the patient develops a systemic mycosis infection. Why? Because the patient is immunosuppressant. Why? Because the patient has HIV. Okay. So what would be the answer here? Histoplasmosis. Impaired dissemination released within macrophages. Hmm.
Doctor, can you explain this again, please?
So the patient has HIV. Due to HIV, the patient becomes immunosuppressant, and we know that due to which the patient's infection spreads within its whole body. Okay, and it is now develops a systemic mycosis. Okay, and when the patient develops systemic mycosis, his other body areas are also going to get infected other than its lung area. Okay, now the patient liver is also affected, its spleen is also affected, its bone marrow is also affected, and we know which systemic mycosis affects the bone marrow, which systemic mycosis affects the e- which systemic mycosis affects the liver and the spleen. That is histoplasma capsulum, and the histology picture as well is much more consistent with the histoplasma. Okay, that's why he's seeing pancytopenia, hepatosplenomegaly. See the signs and symptoms of histoplasma. There is splenomegaly, there is pancytopenia. Okay, all of these can be explained by histoplasma. Okay.
Okay, got it. Thank you.
Recurrent transient pulmonary infiltrates. History of bronchial asthma. Several exacerbations over the past few months. Okay. Currently asymptomatic. Never traveled outside the US. Taking the medications. Complete blood count shows eosinophilia. Chest CT scan reveals proximal bronchiectasis. Eosinophilia related to the colonization of the which of the following? So, eosinophilia. Okay, which of these which of these organisms is associated with asthma, bronchiectasis, eosinophilia? Which one it is?
Aspergillus.
Aspergillus. And what is the name of the pathology?
Allergic
bronchopulmonary aspergillosis.
Allergic bronchopulmonary
aspergillus.
aspergillosis. Okay, allergic bronchopulmonary aspergillosis, hypersensitivity response to aspergillus, associated with asthma. Our patient has asthma and cystic fibrosis, may cause bronchiectasis. Our patient has bronchiectasis, and eosinophilia. Our patient has eosinophilia. All the three findings are present in our patient. Okay, the patient has eosinophilia, the patient has bronchiectasis, the patient has asthma. Okay, so the right answer is going to be aspergillus. Okay, aspergillus, aspergillus skin disease, hypersensitivity. On to the next one. Which of the following pathogen most likely? Okay, see the options. He was tested positive for what? Staph influenza A. High fevers, etc. Post-influenza. Post-influenza. Which bacteria causes the infection? Post-influenza. Post-virus.
Staph aureus.
What are the name of the other ones? Other than Staph aureus, what are the name of the other ones?
Strep pneumoniae.
And Haemophilus influenza and
Influenza.
Haemophilus influenza. These are the four. These are the three which can be present after the post-virus. Strep pneumo, Staph aureus, Haemophilus influenza. Our patient has a he was tested positive for influenza A, and after 2 days he develops high fever, cough, productive yellow sputum, sharp right chest pain, and shortness of breath. Are you seeing any strep pneumo here? No strep pneumo in the options. Okay. Any Haemophilus influenza? No Haemophilus influenza in the options. So the only answer option that we are left with is Staph.
Staph aureus.
Staph. Okay. Influenza virus super infection with Staph aureus. So these are options.
That's a boy. That's a boy, Brian.
Okay, diagnosis here. What is the diagnosis? Fever, night sweats, productive cough, bright apical lung lesion, placed in respiratory isolation.
Tuberculosis.
Yes.
TB.
The diagnosis is TB. Okay. We know caseous necrosis do happen in TB. B lymphocytes? No. Intercellular bacteria, okay. Interferon secretion, okay. Epithelial, okay. Does D occur in TB? Does D happen in TB response? We know that B lymphocytes does not involve in TB response, right? Okay.
Yes.
Which option will be the last thing that will last to occur in TB response?
C.
The last to occur in TB response.
Necrosis.
Yes, necrosis is the last one to occur. Okay.
Yeah.
Before necrosis, which thing is going to occur? Before necrosis,
A, I think.
a epithelioid transformation
Yeah.
of macrophages. Just before necrosis, you are going to see epithelioid. Okay. Before the epithelioid conversion, what is going to happen? Before the epithelioid conversion.
C.
B.
Before the epithelioid conversion. Yes.
It's
Interferon
Typhoid
secretion.
hypersensitivity reaction.
Yeah. Before epithelioid conversion, you are going to see interferon secretion. And before interferon secretion, you are going to see intracellular bacterial proliferation. Okay. So C is the right answer. Okay. First, you are going to see intracellular bacterial proliferation. Then T lymphocytes are going to come there, and then T lymphocytes are going to secrete cytokines, which are going to convert macrophages into epithelioid and giant cells. And the giant cells and the epithelioid cells are then going to secrete their inflammatory mediators there, which are going to cause the necrosis there. Okay. So C is going to be the right answer. The first thing that is going to occur is intracellular bacterial. Okay. Okay.
Mm.
55-year-old come to malice and cough. Cialis, scrotum, occasional history of alcohol disorder.
Brian, Munsan. Okay.
Okay. Is it some type of granuloma? Do you think it is granuloma here? Do you think it is granuloma?
Seems like because there is actually
No.
It is not a granuloma, right?
No.
Yes?
No.
Looks
It is
like
not.
It doesn't look like that. No.
It does not. So it is not sarcoidosis, right? It is not
Yes.
tuberculosis. Okay. We have seen many histology pictures of granulomas, right? And none of them looks like this, right? It is not
Yes.
granuloma. Okay. So we are left with A, B, and C. Do you think it is some type of cancer? Or
maybe.
do you think it is some type of infection?
Yes.
These two.
It looks like cancer because it has irregular borders.
Okay, if I can see the photos. In the photo, can you see the branching pattern? The branching filamentous pattern in this photo.
Yes.
Yeah, looks like a fungi.
Maybe.
The branching filamentous pattern.
I think so.
Wait, let me mute.
Not really.
Can you mute your mics?
I mute the mic. Okay. The branching filamentous pattern is seen in what bacteria? Yeah. I cannot clearly show you.
Actinomyces and nocardia.
Nocardia, in actinomyces and nocardia. Okay, the patient has dental caries, gingivitis, and poor dentation. Okay,
Then actinomyces most
uh,
of the time.
because
The
yeah,
stage.
those are much more consistent with actinomyces.
Actinomycin, yeah.
Yes, these are much more common in actinomyces. Mm, and how can I explain?
And they make the sinuses also. I think to look like that pretty there is some sinuses.
Okay, I'll show you actinomyces. Actinomyces is much more like poor dentation, and there is every symptom like that. There is actinomyces. Um, oh, here it is. I'm talking about this pattern. These lines. This is a branching filamentous pattern. You can see it if you like little bit zoom in into the photo, then you can find this branching filamentous pattern. If you zoom in this photo, you will see this branching filament pattern inside this
Yeah.
purplish line.
Yeah,
Okay.
but it was so deceptive.
Yeah,
Yeah.
that branching with it is inside that purple area. Okay, and we know that it is common with the abscesses which we are seeing in this patient. Okay, abscesses are also here, dental caries, and other maxillofacial trauma. Okay, our patient has gingivitis, has poor dentation with the dental caries, and the patient has a prior episodes of binge drinking. Okay, all of them. And okay, so the right answer here is going to be actinomyces. Okay, see this photo. See this photo. In this photo, this is much more visible. Branching, filamentous branching bacteria. See, within this purplish area, you are going to see filaments. Okay. Now, can you appreciate the filamentous pattern? In this, within this photo, you are going to see the filaments. Okay. These are the filamentous branching pattern. Okay, and lung adenocarcinoma looks like this. This is the photo of lung adenocarcinoma. Okay, which is not in this case. Let's move on to the next one. Which of the following is the most likely cause of these patient symptoms? Bursts of coughing. Comes to due to 4-week history of 4-week history. Bad cold lead lasted about 10 days. The sneezing, running nose, and muscle aches that accompanied the cold have improved, but the cough has persisted and worsened. The patient has bursts of coughing for several minutes as he feels unable to clear the mucus. And the attacks were so severe that the patient develops vomiting afterwards, post-tussive vomiting as well. Okay, he received all his childhood vaccination, but has not seen a patient in many years. Okay, he has childhood vaccination, but has not seen a physician in many years. Chest X-ray is unrevealing. Do you think it is lobar pneumonia?
No.
Bronchial.
So gram-positive diplococcus is not the answer. Do you think it is interstitial pneumonia?
Bronchial.
That's likely. It will look like bronchitis.
The chest X-ray is unrevealing, and in interstitial pneumonia, the chest X-ray is much more severe than the presentation. right?
Yes.
And mycoplasma is the one which causes the interstitial pneumonia.
Interstitial.
Do you think it is TB? Post-acute vomiting, the patient,
No.
no, it is not.
No.
No.
Okay.
Night sweating, weight loss.
I
Yes.
think it's whooping cough.
It is whooping cough. The patient is
yes.
suffering from pertussis, and the
Is
whooping
dementia.
cough has three stages. The whooping cough has 3 stages. First is coryza stage, Bertula pertussis. Okay, this is a gram-negative coco
Bacillus.
bacilli. In the first stage, you are going to see low-grade fever and coryza. Our patient has sneezing, runny cough, has a bad cold during the first 10 days. That is the catarrh stages. In the next stages, there are paroxysms of intense cough followed by inspiratory whoop and post-acute vomiting. Our patient is at the second stage. Okay, our patient is at the second stage. It is gram-negative Coccobacillus. The answer is going to be here is
Gram
B.
negative.
And why? Is because the pertussis require booster vaccine. Like after the childhood vaccination, you need to get the booster vaccine after every 10 years. Okay, and the patient only takes a vaccine in its childhood, but he never takes a booster vaccine. Okay, that's why the patient develops the pertussis here. Okay, whooping cough.
And it's also if it happen in some adulthood, and after cough there's happen of syncope.
Yes. Okay, so let's move on to the next one. Important host factor in preventing. Okay. Okay. So can you tell me which of these protein is involved in the entry of the influenza inside the cell? There are two main
Hemagglutinin.
okay, so there are
Yes.
there are two main proteins. One is hemagglutinin and the other is neuraminidase. That neuraminidase protein is involved in the release of the viral progeny. Okay, it is after the cell gets infected, and to release that is the viral progeny within the cell, neuraminidase is involved. And to enter the influenza inside the cell, you need hemagglutinin protein. Okay.
As it ends in the hemagglutinin it's facilitated to enter the cell.
Hemagglutinin let the virus in. Neuraminidase send the virus away. Okay. Okay, these are the two protein contain hemagglutinin, which binds the sialic acid and promotes the viral entry, and neuraminidase promotes the progeny viral release antigens. These are the two main proteins which are found in influenza, and these are the two proteins which are involved in the influenza infection. And so even when we give the vaccines in the influenza virus, the vaccine contains these two proteins. Okay, so which one we know it is either going to be A or it is going to be B. Okay, so out of these two, which one is going to be the answer? Because now the cells are not getting infected. So that's mean virus is not getting inside the cell. Okay, and
Hemagglutinin.
so what would be the answer? Antibodies against Hemoglobin. Okay. Let's move on to the next one. Which of the following additional finding is most likely to be present in this patient? Cruise to Hawaii, watery diarrhea, high fever, headache, mild confusion, and dry cough.
Legionella.
Temperature is 104. Lower lobe crackles. Bilateral lower lobe interstitial infiltrates. Temperature is 104. Patient has watery diarrhea. The patient was on a cruise ship to Hawaii. What is going to be the diagnosis? What is the main bacteria here that is involved in causing this pneumonia?
Legionella.
Legionella.
Legionella, right. Okay. Gram positive diplococci is the feature of option number B is the feature of what bacteria?
Strep pneumonia.
Strep pneumonia.
Strep
No,
pneumonia.
don't
Pneumonia.
strep.
Pneumonia.
Strep.
Option number A is the feature of what microorganism?
Parasite.
Aspergillosis.
Aspergillus.
Aspergillus.
Okay, Aspergillus bronchopulmonary. Aspergillus. Option number E. Presence of cold glutenins.
Mycoplasma.
Mycoplasma.
Pneumonia. Okay. We are left with C and D. Which one is consistent with Legionella?
See.
See, mostly the
See.
hyponatremia.
Hyponatremia. Hyponatremia.
No serum sodium. Gram negative. You can see labs may show hyponatremia. Okay. Outbreaks associated with cruise ships. Okay. The patient develops fever, GI symptoms. For GI, you are going to see a diarrhea. That's why the patient develops hyponatremia. Okay. Legionella, okay. Everything can be explained. High fever can also be explained. Okay, McConaughey egg. Encapsulated gram-negative bacilli. Those pink mycoid colonies on McConaughey egg. Comes to the emergency department due to 2 days of fever, chills, chest pain, productive cough, on several occasions, exacerbation of chronic bronchitis. Temperature is 104. There are crackles in the right upper lobe. What type of pneumonia it is?
Lobar.
Lobar pneumonia.
Lobar.
Pneumonia.
Name the 3 bacteria involved in lobar pneumonia.
Strep pneumonia, Legionella, Klebsiella.
H influenza.
Strep pneumonia, strep pneumo is gram positive or gram negative?
Gram positive.
Gram
Gram positive.
So
Positive.
strep pneumo is eliminated. Pseudomonas is eliminated. Mycoplasma, Moraxella. We are left with 2 options: Klebsiella
H
and
influenza.
Legionella. Does Legionella appears on gram staining?
No.
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 Silver screen.
No.
So we are left with only one option: Klebsiella. Okay, it is the bacteria which it is a gram negative bacteria. Klebsiella, gram negative bacteria. Okay, it is a gram negative rod. It appears on McConaughey agar. A fermentation of lactose on McConaughey agar. Examples include Citrobacter, E. coli, and Klebsiella. Okay. Okay, let's move into this question. Issue of the following is the following. Okay, 32-year-old woman comes to the emergency department due to 4 weeks of vaccine cough. Unintentional weight loss as well over the past few months. Bilateral crackles, diffuse interstitial infiltrates. What type of staining we used in methenamines?
anything.
Silver staining and bronchoalveolar lavage. Okay. Does anyone knows in which microorganism we use this type of staining?
Pneumocystic gyrovasi.
Yes, we use this type of staining, pneumocystis gyrovasi. And the histology picture is also much more consistent with pneumocystis. See this photo.
Disc
Same
shape.
color, yes, same
Yeah.
color background in this photo. And there are these blackish circle coin-like things, disc-shaped yeast. What type of methenamine? Silver stain of the lung tissue, diagnosed by bronchial lavage or lung biopsy. Disc-shaped yeast can be seen on methenamine silver stain of lung tissue. Okay. Diffuse bilateral ground glass opacities on chest X-ray with pneumonia. The medications we are going to use are TMP SMX, pentamidine, Pepsone, atovaquone. Okay. what is going to be the answer here?
E.
E.
TMP SMX.
Yes.
Bactrim. Yeah.
Okay. TMP SMX. Bilateral interstitial infiltrates. Diffuse bilateral ground glass opacities. We show the following is most likely to be present in this patient: pulmonary lesions. Okay. 21-year-old healthy man comes to the office with a fever, malaise, myalgia. From exploring caves. Where? In Missouri. Fever, malaise, myalgia, pneumonia symptoms. Exploring caves in Missouri. Temperature is 109. These lung crackles. Parenchymal infiltrates within large intestinal and hilar lymph nodes. Okay. Any idea which microorganism can link all of these 4 findings? Pneumonia, Missouri, exploring caves, enlarged lymph nodes,
Histoplasmosis.
histoplasmosis, budding yeast with a thick capsule.
Crypto.
It is Cryptococcus neoformans.
Newfoundland.
It is usually cause infection in immunocompromised patient. Okay. Okay. Let me show you first. Let me show you. Mississippi and Ohio river valleys. associated with bird or bad droppings in caves. In caves, our patient is is doing cave exploration. Our patient is exploring caves in Missouri. Okay. Round cephreoles with multiple endospores. Round cephreole with multiple endospore. But what is the name of this microorganism?
Coccidioids.
Yes. State hyphae with dichotomous branching. Septate hyphae.
Aspergillus.
Aspergillus. Pseudohyphae.
Candida.
Candida. Macrophages with intracellular small yeast is histoplasma. Histoplasma epsilon granulomas. Okay, we are almost done with the pulmonology. I think so. Only 15 questions are left, and they are only of pathophysiology. Only 15 questions are left. Other than that, all of the we have done with anatomy, embryology, physiology, pharmacology, immunology, pathology, and pathophysiology. Almost there are 260 questions of the whole pulmonology. That is like 260 divided by 3600. That is like 7.2% of the whole U world. We are done with almost 7.2% of the whole U world. Okay. So after this, most likely we will start another system. Okay. Okay. So this is all for today.
Do
So I
you,
don't know.
sorry, do you know which system are you gonna start after this?
Okay, I will let you know within 1 2 days.
Okay, thank
I
you.
will let you know. Okay.
Thank you so much.
Most probably I am going to start either endo or renal.
Okay,
Okay. Okay.
thanks.
Because you people have already covered endo and renal. After that, I'm going for the cardio. Okay, because my main goal is to cover almost 1,000 to 1,200 questions within 1 month, and to
Mm.
complete all of the U world within 3 months. Because there are 3,600 questions, and if we do one block each day, we can do 1,200 questions in 1 month. Okay.
Yeah.
Okay, so this is all for today. I do not know whether the next session will be available to the ones who did not pay up till yet. Okay, so if you haven't done the payment, please clear the payment. Okay, so okay, bye bye. Okay,
Thank you so much.
All right, thank you.
Thank you very much.
okay, bye bye.
Hey guys, I wanted to ask, is this your first UWorld since you started with the doctor, or has it been going? Hello. Can someone please answer me? Hello. Hello guys. Can someone please answer me? Have they started doing UWorld today, or has it been going on for a few days?
Hello.
Hello.
Yes, ma'am.
Today was the first day that they started UWorld for respiratory.
This is first class, ma'am.
I can't hear you.
This is my first class, ma'am.
Okay. So this was the first class.
Yes, ma'am.
Okay. So it's going to go on for like a month, right?
Yes.
Okay. Because I'm thinking, are they going to send the link every day in the group?
Ma'am, just could you please tell me? I did not attend previous classes, and
Same.
then
I did not attend as well.
okay. So how you will do that?
I think I thought one of you guys probably know what's going to happen, because I don't know what's going to happen for tomorrow.
Right. So you also don't know.
Yeah, I don't know.
Okay. So let me check what will happen tomorrow. Okay.
Okay. All right. Thank you so much.
Okay. Thank you. Bye.
All right.